Thank you for joining us. We are excited to share with you the journey of a cross-sector partnership to align efforts for advancing health equity. You will hear directly from partnership organizations and learn more about their powerful story. First, the team at NACHC and AAPCHO would like to acknowledge the Robert Wood Johnson Foundation for their generous support of our program and efforts to showcase the impact of community health centers and their cross-sector partners. My name is Sarah Halpin. I'm the Program Associate for the research team at the National Association of Community Health Centers, and I'm part of the team at NACHC and AAPCHO that work together on this program funded by RWJF. I had the privilege of working with Sun River Health and Feeding Westchester, and I would like to briefly provide some background information before you hear from them. In the fall of 2020, our team recognized the challenging moment community health centers and cross-sector partners were in as they cared for their communities during the pandemic. We wanted to support the work that they were already doing and meet them where they were in their respective journeys. As a result, we wanted to use the Design Sprint framework to do just that. A Design Sprint cohort is a short burst of facilitated training and technical assistance with peer-to-peer learning focused on cross-sector collaboration and creative problem solving. The Design Sprints will create the space and structure to facilitate cross-sector collaboration, data sharing and analysis, gap identification and health equity, and continuous process improvement. By leveraging SDOH data, design sprints can foster strategic alignment between health centers and their health and human service counterparts, including community-based organizations, public health departments, and other social service providers. Through a human-centered design thinking approach, NACHC and AAPCHO created the space to catalyze local community partnerships that can use data-driven strategies to manage complex patient care, prioritize population health needs, and collaborate on upstream courses of action that improve and sustain health equity. Our design sprint used RWJF's theory of change for alignment framework, which has 4 pillars centered on shared purpose, data, governance, and finance. The framework also acknowledges that community voices, equity, power dynamics, and trust greatly impact and inform cross-sector alignment. During the design sprint cohorts, 4 cross-sector community teams were selected to participate in 4 different cohorts. Each cohort was comprised of a 3-month-long design sprint process, including sharing of best practices and training and technical assistance. Each sprint focused on building partnerships and stakeholder-led strategies consistent within the domains of RWJF's theory of change: shared purpose, data, financing, and governance. I'd like to take a moment to provide some context and share our guiding why in developing this program. Our country is at a critical juncture with the global pandemic, racial reckoning, and economic downturn, catapulting the need to identify the policies and structures that create health disparities across our communities. It has long been known that racial and ethnic groups, as well as special populations, are most impacted by structural racism and systemic discrimination. As communities respond to and rebuild from COVID-19, there is an opportunity here to drive systems level transformation to ensure all communities are healthy and thriving. Now, I will let Jillian Annunziata from Sun River Health introduce herself and the incredible work that Sun River Health did with Feeding Westchester.
Good afternoon. I'm going to be presenting on our partnership around a food security program. My name is Jillian Annunziata. I am a senior program manager at Sun River Health, the largest federally qualified health center in New York State and one of the largest in the country. And we have partnered on this work with Feeding Westchester, a food bank in Westchester County, which is part of the Feeding America network. This work takes place in the Hudson Valley, New York State, at 2 sites, 2 of our primary care sites, and the surrounding Feeding Westchester neighborhood network around those sites in Peekskill, the city of Peekskill, and the city of Yonkers in Westchester County. The mission of Feeding Westchester is to nourish our neighbors in the fight against hunger and to lead a unified effort for a hunger-free New York State. And the mission of Sun River Health is to increase access to comprehensive primary and preventive care and improve the health status of the community, especially for the underserved and vulnerable. A little bit about our overall partnership. We work together with the Feeding Westchester Executive Director and Nutritionist Specialist and Sun River Health Program Manager and AmeriCorps members, as well as clinical and operational leadership at the sites and across our network, along with frontline clinical and operational staff and promotoras and community health worker staff as well. The focus of this work is on the social determinant of health core domain of food insecurity. And we came to work together on this to address the community challenge of food insecurity, because Feeding Westchester approached Sun River Health with a funding opportunity to source the produce, and Sun River Health had an appetite for developing a comprehensive social intervention like this to identify and address food security within our patient population, understanding the critical ties to health outcomes of social interventions like this around lifestyle, behavioral, and social needs and risk factors. And we wanted to work on this issue as a partnership rather than on our own because of the rich history of Feeding Westchester and addressing food and hunger in the same communities that Sun River serves. And so we knew that partnering together and joining our systems and joining the trust that we have, that our shared populations have in each of us would make us stronger together than apart. And would also kind of meet supply and demand, where we could connect the dots on behalf of our patients by connecting with each other and sort of meeting them where they are to offer increased access to primary care and preventive services, as well as increased access to food and hunger assistance under the same roof through our collaboration together. This is a high-level look at the workflow in which we are identifying and addressing food insecurity at a healthcare facility through the Hunger Vital Signs evidence-based food insecurity screening tool that is conducted by clinical assistants, LPNs, nurses, clinical support staff at the health center during a patient visit. And then a referral is made to Feeding Westchester and their partners and to this program if the individual screens positive. From there, there is a monthly fresh produce distribution on site where the 105 patients across the 2 sites come on site each month to get a bag of fruits and veggies, nutrition education related to maybe their diagnosis or just general nutrition ed, as well as connections to enabling services within the health system network as far as certified diabetes coaching, if they have diabetes, nutrition visits one-on-one with one of our nutritionists, IPACS exam for diabetic retinal eye exam, again, if patients are experiencing diabetes, office visits to check in for their annual visits or diagnosis-specific visits, and then also connections that are made to our community-based organization partners. As I mentioned, the network of Feeding Westchester's partners who also support with hunger and food assistance programming, such as fresh markets and food pantries, services Feeding Westchester offers themselves, such as nutrition workshops and SNAP and WIC enrollment. So the food distribution each month is really an incentive to engage the patients in both our primary and preventive services related to their needs, and enabling services inside and outside our 4 walls and in between those office visits on site, and overall engagement through these beautiful vegetables and fruits that we're so generously given by Feeding America, Feeding Westchester, and are really just a joy to have and to be able to offer to folks. And we even reach beyond the patients in our cohort, because if not everybody shows up each month, which is inevitable, we are able to share with our staff who's involved in the program and care managers and other staff who are on site who help refer patients into the program and connect patients to this, and are also, and other patients who are in the waiting room or what have you, who can reach even beyond those in the cohort. which is always a pleasure as well. And finally, improved clinical outcome measures, which I'll talk more about in a moment, as a result of this social intervention is a key part of this workflow. So there's just a glance at some of our resources: virtual nutrition workshops, SNAP outreach, education program, the flyer for the monthly distributions, and the calendar for Feeding Westchester's network of programs and partners nearby each of those health centers where the patients can access similar distributions for free throughout the month, and at other locations as convenient for them. So there's all these sorts of flyers when the patients come for the distribution, where we're connecting them inside our four walls and beyond, answering questions and trying to leverage that encounter for improved access and engagement to enabling services ongoing. Here's a glance at our Feeding Westchester delivery truck and some of our AmeriCorps receiving that for our peak skill distribution day. And that's one of our clinical champion providers, Dr. Warbe of the Hudson Valley and the peak skill site, who helps reinforce the workflow to providers and clinical staff. Here's a glance at the Park Avenue distribution in Yonkers. This is actually a couple of photos, one from the other day there at the bottom, with one of our clinical leads, Dr. De Los Santos, and some of our AmeriCorps. And then to the left, and where you see those COVID testing flyers, this is kind of how we pivoted during the height of the pandemic to partner with some other organizations in order, the Yonkers Office for the Aging, the National Guard, the Fire Department, and Catholic Charities to be able to receive the produce delivery to one of their sites instead of ours when we couldn't during the height of the pandemic, and soliciting their help and their volunteer base to make home deliveries to folks instead of having them come on site to pick up. Here is a look at our data. So process and outcome measures for the peak skill site specifically on the number of distributions, the number of screenings, the number of positive screens, positivity rate you see there, which is 57%, and it's around 54% at our Yonkers site. Number of patients in the program, those with uncontrolled diabetes, because that relates to some of our clinical quality measures, is having that diabetes control measure. So there are 14 patients who are in the program who just have diabetes, but when we look at this sort of improvement data, we want to focus on those who had uncontrolled diabetes at the start of the program. So you see those 40 individuals there, and that of those 27 had data pre and post on A1C lab results. And of those 27, 17 had a decline in their A1C. So they had an improvement in their diabetes control, which is a 63% diabetes improvement rate, which we're really proud of, and is a pretty staggering improvement rate as we think about the impact of this sort of a social intervention and all of the comprehensiveness and holisticness of this sort of a program, and how that can impact the improvement rate on that clinical quality measure. We're thinking about all of the efforts inside and outside of our four walls as a community health center, and then across Feeding Westchester's network of partners, the engagement that are, and the access to resources that our patients have throughout the month and throughout the community, really. And the fact that that dramatic of diabetes improvement rate is seen is credit to that sort of an intervention as compared to some of the more traditional interventions to move this measure, such as retraining of staff and making sure those A1C labs are documented appropriately and things like that to close those kinds of gaps in care. So we're really excited about that improvement rate. And then finally, you see another really key clinical quality measure for us, which is diabetic retinal eye exam for diabetic patients. And the completion rate of those exams for the patients in the program is 52%, again, pre and post program enrollment for those who are due. So that's also a really good number to see. It's trending in the right direction, and it's pretty significant improvement. And this is just another look at those 27 patients who have pre-post data, who A1C data, who are enrolled in the program. And you can see, again, of the 27, 17 saw improvement, or 63%. So the pre-A1C is the blue bar, and 17 of those 27 had a post-A1C that is lower, so the green bar being lower than the blue. And the time frame for this data, I should mention, is from September of 2020 until July 2021. So just about a year. The NACC design sprint experience we've had through the social determinant of health design sprint effort over the past several months has been really wonderful, and a strong support of the work we had underway in terms of giving us the space and time together to collaborate outside of the weeds of the program, to really be strategic about where we are and where we need to head, and how to do so specifically. So you see here just a glance at our short-term 0 to 3 month goals, which we achieved in terms of planning a meeting with leadership at each of the organizations, then a meeting with that leadership at both organizations, an interagency meeting, in which we decided on several key planning pieces in terms of implementing this new data collection software called Link to Feed, and being able to leverage the information collected there to really define our data strategy and connect it with the existing data that I just presented in our clinical electronic health record, to the kind of data that we'll be collecting through Link to Feed, which is Feeding Westchester's software that really paints a more holistic picture of the kinds of connections that were made to social service agencies in their network, and whether those referrals were kept, and whether the patient enrolled in SNAP or WIC or their housing status changed. And we think that'll be really beneficial to understanding the impact of this program, and will be a nice visual presentation of the sort of the story of the program and the patients who are involved, that we could present to the patients and the community to understand the impact of this program and the areas of need that still exist where we could hopefully expand our reach to meet that need. And you see beyond that, our goals for the next 3 to 6 months include what I was just alluding to there about sharing the information and getting input from the community about their impressions of that, and where we can go next to continue our ongoing performance and program improvement. Again, this is a list of what I went over just now, as far as how far we've come just in these past few months through our involvement in the strip. The sprint is really like articulating these goals and then actualizing several of them, having those meetings, having those decisions, and getting those contracts signed to implement the new software, and really galvanizing a core group of team members on both agencies to participate in the work and connect the work, align the work with other areas of the organizations that relate. So just this morning, this work and the data I presented was presented to our Clinical Quality Council at Sun River Health. And in June, it was presented to our board of directors. So it's really helped to elevate the progress we're making and the success we're seeing by connecting the work to other areas of my organization and Sun River and Feeding Westchester's as well, where there's related work being done. And this showcasing this is helping to connect the two and advance them both. So we're proud of the implementation, and we've also submitted a grant application related to this work, and so has Feeding Westchester during the time of the sprint. So a lot to be proud of and to have accomplished in a short time frame thanks to the sprint. As far as next steps, we hope to continue process improvement, such as getting more pre or more post data on A1Cs. So making sure to, again, leverage that distribution on site to get labs for those folks who don't have those yet. Thinking about monthly automation and outreach, as opposed to having our AmeriCorps and promotoras call each month to invite folks to join, because staffing is definitely an issue, and we rely heavily on those non-full-time staff members for this work. So I want to always be thinking about automating areas where we can take some work off of their plates, and so that we could transition this to a more sustainable staffing model in the future, with site staff and full-time staff taking on more of this work as part of their regular workflow. I talked about incorporating community voice in our plan to do that. And we're launching nutrition education classes on site during the distributions each month as well, starting in September. So Feeding Westchester staff is actually going to lead those. They're nutritionists for our patients, whoever is able to join while that session the day of their pickup. And I spoke as well about our implementation of this data software, which will help paint a more picture of the impact and the story that our collaboration is having. So our proudest moments include galvanizing that core group of team members, aligning the work across networks, across partnerships, and making some really key decisions about implementing things like our new reporting software and our education workshops. And the key takeaways of the sprint methodology overall that we worked on here with NACC and AAPCHO's leadership include the trust for our partnership and our shared goals that brought us together initially, and that continue to drive us despite some differences in our history and our operating environment and our funding sources, and you name it. But the fact that we have aligned goals and we have such a rich history now of a close partnership in reaching those goals, and reminding ourselves of that, and to take time to support that and meet to really feed that is so critical to thinking about how the work's going to continue to evolve. And so trusting your partner, trusting your design, the design sprint methodology, which sometimes was kind of repetitive in nature, but really helpful in encouraging us to be thoughtful and methodological about our decisions, and the need to create a space where we could brainstorm as a group and come up with next steps. So another takeaway is the importance of awareness that there are a variety of funding sources available to support this work, and that we have to continue to prove our impact so that we can leverage those and benefit from those. And finally, the importance of leadership buy-in as a critical resource to gain the support that is needed to really make this work sing and to allow it to expand. So that is all. Thank you for listening. And if you have any questions, I should have included my contact information, but my name is Jillian Annunziata at Sun River Health, and I'm happy to discuss more about the details of our implementation of this work, and to connect if helpful in any way. So thank you.
Thank you so much, Jillian, for taking the time to share your story. You all did incredible work, and we really appreciate you sharing your learnings with others. We'd like to thank RWJF again for their generous support of our programs. For more information, or if you have any questions, please feel free to email us at prapare@nacc.org, and we will be happy to address them. Be sure to stay connected and join our listserv so you can stay updated on new resources and tools related to SDOH and advancing health equity. And finally, if you'd like to contact Jillian, her email is provided here. Thanks, and take care.